All right, Brandis, thanks a lot. And for many of us, social media is a convenient way to keep in touch with family, friends, and colleagues, but sharing false information or misinformation on platforms like Facebook during this global pandemic can mean life or death. A recent nationwide survey of more than 20,000 Americans across the country found that those who rely primarily on Facebook for COVID news were less likely to get the vaccine than those that relied on other sources. Joining us to discuss social media misinformation in the age of COVID is Peter Adams, Senior Vice President of Education for the News Literacy Project, an educational nonprofit dedicated to news consumption. Peter, good to see you again.
It's great to be with you.
All right, so this study came out of Northwestern and basically found that those that relied on Facebook for their primary source of information on COVID were less likely to take the vaccine, more likely to distrust the vaccine than the general population. What do you make of data like that?
Well, I think it's consistent with what we've seen in the past when people, the Pew Center had a similar survey back in 2020, last summer, that basically said the same thing. People who rely mainly on social media for news, and especially those who shun mainstream standards-based news sources, are often less informed, follow news less closely, and are more vulnerable to false beliefs and misinformation.
And when you see these kinds of studies, how big a role is Facebook and other social media playing in the situation we find ourselves in right now, where still significant portions of the population refuse to get vaccinated and we see the Delta variant surging?
Sure, it's, the cause and effect is a little tricky here. It might well be that people who distrust mainstream news sources or are cynical or nihilistic about them turn to Facebook. And it might be that some folks who are not that way to start with see messages on Facebook which inflame that and sort of turn them toward disinformation. So it's probably both. But what we know for sure is that despite Facebook's statements that they will take down COVID misinformation if they see it, there's a lot of COVID mis and disinformation on the platform, including members of the so-called disinformation dozen, right? The 12 people who are responsible for something like 65% of anti-vaccination misinformation online.
Who are they? I don't know who they are. I mean, or just give me a sense of who those 12 people are.
Joseph Mercola is one of the most pernicious. He has a lot of wellness products. He has books, anti-vaccination books, even on Amazon, right? So Facebook's not alone in exacerbating this problem, but he has a page on Facebook. Sherry Tenpenny does as well. And they peddle, provably false claims about vaccines and really inflame people's fears at a time when, we desperately need clear, accurate information about the safety and efficacy of the vaccine.
That was going to be my next question. I mean, is most of this coming from people who are knowingly disseminating this kind of information, but it's lucrative for them? They're building their brands. They know that it gets a lot of attention. It riles people up.
It's hard to know. Certainly there are anti-vaccination activists out there, and probably some of those dozen that I just mentioned, who fervently believe that what they're saying is true. They base a lot of their beliefs on widely disproven studies, even studies that have been retracted. So intent is really hard to know. The impact is something that we can actually look at and think about and try to measure. Facebook doesn't make that easy, by the way. They make access to data on the platform. Their transparency, is very opaque. Researchers don't have the access they need to actually track these things very well.
And tell me, what are the examples, like the most pernicious examples of disinformation messages that get shared widely on Facebook? What do they say about the vaccine?
Sure. I mean, they push a lot of false claims about the vaccine sort of changing your DNA, which isn't true. An old rumor was implanting microchips. One rumor is that, Big Pharma has sort of constructed the pandemic or blown it out of proportion to push this as a money grab or to normalize vaccines. So you see a lot of rhetoric that resembles previous anti-vaccination messages, but we've seen some new ones as well throughout the pandemic.
And you're saying Facebook isn't doing enough. I mean, what else does this platform and other platforms have to do to help stem this problem?
It's tough. There's no one silver bullet. I think one thing that they clearly need to do is really enforce their community standards. So they need to moderate their content more aggressively and more consistently, and they need to walk the walk. they also need to give researchers access to data so that we can learn more about how misinformation circulates. And then finally, I think they need to take a really serious look at the role that their own algorithms play in helping people like this network and reach new audiences. So anti-vaccination activists, disinformation activists, extremists want to be on mainstream social media platforms like Facebook so that they can expose people to their message and maybe draw them in. So giving these people a platform, is a real problem, especially when your algorithm could drive someone who's doing some searching and is curious about these topics right into the hands of some of these actors.
Yeah, I mean, there's a documentary on Netflix about those algorithms that really take people down the rabbit hole. And this, we've talked about this before, Peter. I mean, this obviously isn't limited to COVID. Social media has spread all kinds of disinformation on the election. I know they tried to crack down on that a little bit. What is the larger solution here? Because it does confuse a lot of people.
Sure. I think, look, there's no one solution. It's got to be a sort of multi-pronged approach, I think, on the part of the companies. Better content moderation, more resources in that direction. They need to do a better job of really pushing and promoting credible information. And then, as I said, really work on how their algorithms are functioning. But we as a public also need to do our due diligence, right? Don't exclusively rely on any one source of information, especially if it's user-generated content, and to do a better job of understanding why certain things might appeal to us. In an event like the pandemic, we're looking for easy answers. We're looking to it's a very fearful, questionable time. It has been for some time, and it's driven a lot of people online searching for answers. The problem is we prefer simple answers to complex problems, but there are no simple answers when it comes to this pandemic, and we should be ready to sort of wrestle with that and accept that.
Yeah, people wanting simple answers. That's kind of why conspiracy theories take root in a number of areas. All right, Peter Adams, thanks for joining us as always.
Thanks so much.